My name is Jamal Alford, and I'll be giving my healthcare reform interview presentation. My interview on Leanne Werkheiser. She's employed at Accordius Health of Aberdeen, North Carolina, and her occupational position there is nurse manager. She's been there for almost 24 years. The questions that I decided to ask her just dealt with mostly with employment law. The first question I talked to her about was dealing with at-will employment. Now, employment at will is where employers have the right to dismiss an employee at any time for a good reason, a bad reason, or even no reason at all. Employees enjoy somewhat of a corresponding right to have employees to leave an employer at any time as well, even without a reason as well. Most states except for Montana follow this doctrine, but there are restrictions on how freely and for what reason employees can terminate an employee. With this, I discussed with Ms. Werkheiser, under the law, at will employment doctrine, has an employee been terminated without a reason or notice, and what was that reason for the employee's dismissal? She said yes, several employees have been dismissed from the floor. A few had to be escorted from the premises when told their services were no longer needed. The reason for dismissing the employee was the harassment of other employees and not performing patient care duties. Under the North Carolina Equal Employment Practice Act, EEPA, unlawful workplace harassment policy, employees are protected from workplace harassment in North Carolina based on race, color, national origin, religion, age, sex, or even handicap. The next question I asked her about was dealing with health insurance portability and accountability act privacy rule. The HIPAA Act privacy rule provides federal standards to safeguard the privacy of personal health information and give patients an array of rights concerning their information, including the right to examine and obtain a copy of their health records and to request corrections. I asked Ms. Werkheiser, has an employee ever violated HIPAA privacy rules, and what happened to the employee once the violation was discovered? She answered, unfortunately, there has been a situation where an employee has violated HIPAA privacy rules there. The employee was caught video chatting with someone on their smartphone while performing patient care. The company dismissed the employee for violating the patient's Bill of Rights under the HIPAA law. And finally, I asked her about employment law that's dealing with the U.S. Equal Employment and Opportunity Commission. Through the Equal Employment Opportunity Commission, or the for protecting you from one type of discrimination, and that's employment discrimination because of your race, color, religion, sex, that's including pregnancy, your gender identity, and even sexual orientation, your national origin, disability, age, whether you're age 40 or older, or genetic information. I asked Ms. Werkheiser, has anyone made any discrimination complaints against the company with the Equal Opportunity Commission, and what were the complaint and outcomes? She said there's been a complaint to the EEOC before, and the company was understaffed at one point, and someone reported this to the EEOC because of the increased workload on the available staff. During the meeting, the corporation decided to find a solution to recruit more staff and ways to retain them and reduce turnover that would eventually reduce workload on the available staff. In conclusion, employment law affects every part of the workplace. It determines your rights regarding employees, positions, and hiring, distributing wages and benefits, eligibility for overtime pay, discrimination, family and medical leave, termination, and more. It is important that you know employment law and how it affects you in the workplace. Health reform laws can help families have affordable access to healthcare services they need, giving them a sense of well-being and a peace of mind. And although I did not discuss much about healthcare reform laws in any way, these increased benefits and affordable costs can provide extra money for public health and prevention and increase our public health workforce and infrastructure while creating new technology and better quality in our healthcare forces. Because of these laws, we have more benefits that are available to us that help us through the laws and through excuse me through the laws in our workplaces. They help us have better lives and better wages and less discrimination between each other.